For instance, looking at their DNA tells me how their genes are coding for enzymes that run biochemical pathways.
You're listening to the Ethos Athletes Podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes Podcast. Now, a number of you have been emailing asking for information on how you can do better in your performance in the given sport. So you may be a CrossFit athlete, you may be a triathlete, may just be a marathon runner. Regardless of your sport, many of you are interested in knowing exactly what you can do to help improve your performance. And there's so many different factors when we look into improving performance. But one thing that often goes overlooked has to do with the biochemistry of your body and how that can improve performance. For this particular podcast series, I brought in Dr. Warren Brown, who's the owner of Clinical Advances for Sport here in Scottsdale, Arizona, where he specializes in going and helping you improve your performance by adjusting your biochemistry and optimizing that. So Dr. Warren, welcome to the show.
Thank you, Dr. Hernandez. It's a pleasure to be here as a listener of your podcast and a fan and a colleague. It's just great to be talking with you this morning.
Yeah, thank you for being here. So before we get into kind of the system that you look at for going and improving, or the things that you think are important for going and improving performance, tell us a little bit about you and your clinic, and then how did you get into wanting to do this and helping athletes with performance?
Yeah, I am a sports med doctor. I consider myself a sports med doctor, but maybe not so much in the typical sense. I'm not the guy people come to see for orthopedic surgeries or spinal manipulations or physical therapy injections. That's really not my wheelhouse. My wheelhouse is more the biochemistry and the physiology of the body. And really, I look at kind of my approach with athletes as thoroughly assessing the body systems to find the ones that are most critical to performance, find the weakened systems, address those symptoms, and then assist them with maintaining their progress. Basically, that's kind of my goal with athletes and athletic-minded patients. I sort of got into this because in my residency in Tacoma, Washington, I got involved with a minor league soccer team there and sort of did that kind of on the side. And then eventually that became something I got really comfortable with. And over the years have sort of refined my program into what I call the 6 clinical advances for sport. And so each of these different systems that athletes often have 1 or 2 issues with, or maybe serious issues with, I go in and help them address that. And ultimately, the purpose is to get them healthier. So I kind of occupy that gray area between like a musculoskeletal type of practice and a conventional medical provider. I'm sort of right in between there. So I see a lot of athletic patients, amateur, college, professional athletes, but a lot of what I do is just trying to work with people to get them healthier and improve performance through health.
No, that's awesome. And I really like the system that you have developed. And this, like you said, the system kind of includes 6 different aspects that we need to look at when it comes to an individual and their overall performance. And so why don't you go ahead and break down, like just list off these 6 things for us, and then we can go into talking a little bit about each one and giving an introduction into each one.
Sure. Yeah. So really the 6 areas are, in short, gut function, energy production, hormone balance, detoxification, immune response, and looking at their genetics, or what I call structural integrity. So those kinds of things, and we'll expand on each of those. But let's start with digestive efficiency, for instance.
Absolutely.
Extracting nutrients from food is just one of the many jobs our gut does for us. It's more than just breaking down food and bringing it across the gut barrier into the body. It has connections to the immune system. About 70% of our immune system is in the gut. It has the ability to synthesize neurotransmitters like serotonin. Most of the serotonin we make is actually happens in the gut, and it has connections to our hormones as well. Things like there are enzymes in the gut like beta-glucuronidase that can play a role in recycling hormones. So that all sort of fits into what I call digestive efficiency. And for athletes, if they have intense training regimens, or if their diet's not right for them, or if they've got intestinal hyperpermeability, like leaky gut, in other words, then that can all impact their ability to digest and absorb and to handle all of the aspects that our guts are supposed to do for us.
Yeah, no, I'm glad you brought that part up. So, I mean, intestinal hyperpermeability or leaky gut syndrome, as other people may know it, is actually a very common thing that we see in our practice. And I don't think people understand, or I know people don't understand the extent to that, of what having hyperpermeability in your intestine tract can actually do. And so I'm glad you touched on that, where it can really affect absorption of nutrients, different things like that, which ultimately can decrease their ability to perform. What would you say some of the biggest reasons athletes develop hyperpermeability?
I think there's two reasons that I see most commonly, and one of them is the use of nonsteroidal anti-inflammatories, or NSAIDs, medications for pain. They can really just wreak havoc on the tight junctions in our guts, tight junctions that hold cells together, that maintain the barrier in the gut. So when those tight junctions are impacted, which NSAIDs can be one of the many things that cause that, then we have a more permeable gut, and stuff comes across the gut barrier that shouldn't be coming across the gut barrier. So NSAIDs, I'd say, probably one of the biggest issues to help manage chronic pain. These are medications used for muscle pain, joint pain, etc. So I'd say that's one of them. Another one is altered motility or even ischemia, and this tends to happen more commonly with the endurance athletes, where if we're doing a marathon or an ultra marathon, we are basically perfusing our muscles with blood, and we preferentially circulate blood to our muscles rather than our gut. And so if that happens for an extreme amount of time, then there's less blood flow to the gut. It becomes ischemic, which means it doesn't get the nutrients and oxygen and all of the nutrients that it needs to stay healthy. And so it's almost like starving the gut of oxygen, and that can cause cell death in some cases. So it seems like those two issues, probably the most common ones that I see.
What about, what's your experience been? I've heard some doctors talk about, in a high performance athlete or someone that trains extremely hard, you get more cortisol production, which then can, cause issues with intestinal hyperpermeability. Has that been your experience, or?
Yeah, that can be a reason as well. Yeah. Okay. That's a good point.
Cool. That's a little bit on gut function. And again, the purpose of today's episode is really just to go over and give an overview of each particular piece of the system. And then we're going to be spending time in each piece and dedicate an episode for each individual piece, so we can really dive deep into each aspect of the system.
Great.
So let's go into the second thing, give a little bit of overview on energy production.
Sure. Yeah. Energy production. This is a pretty complicated process in the body. We're essentially turning matter from food into energy, which if you think about it, it's really kind of mind-blowing. Yeah. But there's a lot of complexities to it. This is a process that's heavily dependent on the mitochondria, which is a sort of like a piece of equipment inside our cells that can burn substrates. So it's basically taking fats and carbohydrates and proteins and getting them into the mitochondria and turning them into electrons for the purposes of ATP. So that is critical for ATP is the sort of the energy currency for the cell, and that's critical for every living cell. So there's a number of nutrients that impact that. Things like B vitamins, magnesium, manganese, glutathione plays a role. Coenzyme Q10 plays a role. These are all nutrients that either help support the citric acid cycle in the mitochondria or help support the electron transport chain, or both. So they're critical. And there are also things like toxic elements that can impair the enzymes that make these conversions in these pathways for us. So that is sometimes standing in the way of making this progress efficient. Mm-hmm. So there can be a number of different reasons why people don't produce energy as well as they should.
Okay, and so when we're looking at this part, and I know, and for those of you who have listened to previous podcast episodes, you may remember one that we did with Kelly and Michelle, where we actually talk about how muscle cells have the highest amount of mitochondria in the body, and so anytime you go and strength train, you're actually building more mitochondria or you're developing more mitochondria in those muscle cells. Which all leads to the energy production that Dr. Warren's brought up. Now, in a previous talk that I saw you give, you seem to be a big proponent of B vitamins. Is there a reason that you like them so much?
Yes. I love the B vitamins, all of them. And they are critical for the citric acid cycle. They support, they're required cofactors for several of the enzymes within the citric acid cycle that make these biochemical conversions for us. They're also important for amino acid metabolism. They're important for methylation. They play a role in fatty acid metabolism and glycolysis, which is how we utilize carbohydrates. So they're important all over the body. And they're just, it seems like a lot of athletes and a lot of people in general are lacking in B vitamins. So they're just an amazing group of nutrients.
Now, we can discuss this a little bit further on our energy production episode, but one of the fads that we tend to see in health right now, or in health and wellness center, I guess, is going and getting B12 injections and, going and getting your weekly vitamin shot. Is that something that you necessarily believe in, or is there more to it than just come in and get it? What's your opinion on that?
Yeah, I think, shots can be helpful for some folks, especially if their gut function isn't very good. So even in some cases, extreme cases where a patient's gut function is really impaired, it's hard to even absorb things in supplemental form. So that's where things like injections and IV therapy can be really helpful.
Awesome.
I do like the B vitamins as a complex.
Yeah.
So meaning not just B12, not just folate, but really, all of the B vitamins, B1, B2, B3, B5, B6, B7, and folate and B12. So they tend to work best together in most circumstances, but there are definitely circumstances where a B12 shot can be helpful. IV B vitamins can be really helpful. So that's a valuable tool too.
Awesome. Let's move on to cell signaling and hormones.
Yeah, that's what I mean by cell signaling, is just what the hormones are looking like. And this goes beyond just testosterone. There's a place and a patient that requires testosterone, but I don't think it should be given to everybody. So, because there's definitely some pros and cons to supplemental testosterone. What I mean by hormones or cell signaling is that these hormones are the messengers in the body. So they tell our cells what to do, how to perform. And so if the hormones aren't dialed in very well, then that can have big problems. That can mean big problems for how we perform. And it seems like the stress hormones, which would be things like cortisol, like you just mentioned earlier, stress hormones are really something that's overlooked in workups, I think, because cortisol is a wear and tear type of hormone. It's a catabolic hormone. So if we have lots of cortisol, then it will be almost impossible to put on muscle mass or maintain lean muscle mass. Cortisol is a huge problem. So this is one of the things that I focus on most. Even before I even consider touching the sex hormones, I'm trying to work on trying to modulate or manage or balance their cortisol levels, because that can be huge for athletes. I remember when I was in medical school, I was training pretty hard and trying to put on lean mass, but my stress levels were just through the roof. So I wasn't making any progress. So I was frustrated by that. So it was just, it had a lot to do with stress and cortisol levels. So I think that's probably the biggest one. And it seems like with endurance athletes, their cortisol levels tend to be a little bit higher. Mm-hmm. Cortisol typically means that we'll have higher blood sugars as well. So sometimes you'll see somebody who's really skinny having trouble putting on weight, and they've got high blood sugar. And it's just like, how is this possible? Well, it's because their cortisol levels are way too high.
Yeah, no, that's been my experience too. And maybe in this particular episode, we can go into what are some of the best ways to test for that and everything as well, because there's a number of different ways to test that or at least tests that I've seen that that can check cortisol, but there's a lot of them that aren't very good either. So maybe we can go into more detail on that particular episode. I like what you pointed out, that when we're looking at hormone balance, it goes beyond just testosterone and some of the other sex hormones, because I get individuals who come in with lab work from other doctors and nobody else that I've seen runs cortisol. And so it's kind of like, all right, well, that's why you're still not feeling great, because they missed this aspect of it. So it's important to address this piece as well.
Yeah.
So yeah, I like what you said on that. Let's talk a little bit about detoxification. What do you this is a very popular word that we hear quite a bit. Tell me what your definition of it is and how it impacts an athlete's performance.
Yeah, the detoxification that I tend to focus on with athletes most is really around the issue of oxidative stress, which is basically a process by how electrons would essentially shatter through our cells and destroy cells. And that can cause DNA damage. It can cause cell membrane damage. These are things that can happen with oxidative stress. This happens more so in athletes because they are typically taking in a lot more oxygen and burning a lot more calories, and that process is oxidation. So it's essentially oxidative stress is sort of like an unwanted byproduct of burning fuel, essentially. So when I talk about detoxification for athletes, I'm generally focusing mostly on that issue. How do we get the balance right between antioxidant status or total antioxidant capacity and the amount of oxidative stress that they're faced with? Because if we don't get that balance right, then we could cause excess cell damage, meaning if we have more oxidative stress, or if we overcorrect and do too many antioxidants, then it's harder for the cells to sort of do their normal breakdown and rebuild. So it's really, there's this balance that a lot of athletes have trouble getting between the amount of oxidative stress that they're generating and the amount of antioxidant capacity that they have. So I look at that as sort of a detoxification of oxidative stress. And you're absolutely right. You can use that term to mean detoxification of metals or other environmental contaminants, and there's validity to that too. But for athletes, I tend to focus mostly on that area.
And I really do like that, because I don't think oxidative stress is something that many physicians actually are, they may have heard the term, but they don't understand the ramifications that it causes, and they certainly don't know how to test for it. I can't think of one lab or one patient I've had come in with labs done from a previous doc who's actually tested for this. Yeah, I mean, this is something that I do believe strongly goes overlooked and really does impact the body can impact the body in a very negative way once it gets out of control. So I'm really happy that you added, or you went beyond detoxification of like heavy metals and stuff like that, and really looked at what I believe is a bigger problem that people face when you're talking about the detox process. Some of our listeners may be familiar with some of the common labs and stuff, but just to kind of prove my point, are you able, what are some of the things that you can test that actually test for oxidative stress, like some of the lab markers?
There's quite a few different ways you can look at it, but three of my favorite markers are probably 8-OHDG, which is 8-hydroxy-2-deoxyguanosine, which is basically a marker that tells us about oxidative damage to DNA. There's one called lipid peroxides, which is oxidative damage to cell membranes. Mm-hmm. And both of those, there's quite a bit of literature on those, published medical literature on those. You can even measure them in the urine. So they're pretty easy to get. And then, of course, glutathione, our primary antioxidant in the body.
Yeah, absolutely.
It's one you can just order, look at it directly. And if it's low, it's pretty easy. I mean, we have a lot of different tools, as I'm sure you're using a lot of them, that help to boost glutathione levels.
Absolutely.
So that's a good one. I like to see glutathione above 1,000 in the blood. So that's the goal that I'm typically aiming for. But yeah, those are probably my 3 favorite markers.
Awesome. Again, we'll go more into these particular labs. And then I think in the detoxification episode, we should really go and discuss more about oxidative stress and then the negative ramification that can have on an individual.
Yeah, sounds great.
Let's go over to our next one. I believe it's immune response.
Yeah, immune response. So this is basically the immune system is extremely complex, and it's really trying to protect us against viruses or pathogens, but it also works with trying to help manage inflammation. So we don't want too much immune activity, because when we have too much immune activity, like with autoimmune conditions, that tends to create more inflammation in the body. So we always talk about balancing the immune system. That's really important for everyone, especially athletes. With athletes, if they're doing a lot of intense physical activity, that can be kind of taxing to the immune system. Mm-hmm. So they often face imbalances with immune function. Some of it is, could be related to leaky gut and permeability, like we talked about earlier. But some of it could be, the fact that, if they're a wrestler and they're on the mat, and they're trying to figure out why they have chronic skin conditions, then maybe working on trying to help balance that aspect or support that aspect of their immune function. So it ties in a lot to the gut function aspect of my program that we were talking about earlier, just because there's so much immune response that happens in the gut.
Yeah.
But there are things like chronic inflammation and a lot of other challenges that athletes face that really prompt an immune response from their immune system. And we don't want that balance to be tipped either, because if that balance gets tipped towards an excessive immune response, then they tend to have more inflammation.
Right. And then that's, again, going to cause some of the other issues that we've already discussed.
Right.
Yeah, or be a catalyst for the other issues, some of the other issues that we've already discussed.
Yeah.
What about structural integrity? Or I believe it was like genetics, as you mentioned as well, correct?
Yeah, that's kind of that's my approach to structural integrity. And
yeah.
I think that some of the joint injections that you do are critical. I mean, that can be a game changer for a lot of folks. So that's awesome. That's a different kind of structural integrity than what I focus on. I tend to look more at I look at it more from a microscopic standpoint. Like, for instance, looking at their DNA tells me how their genes are coding for enzymes that run biochemical pathways. It's really kind of like microstructures is what I'm getting at with that structural integrity piece. But also too, there's definitely a place for surgery, for rehab, I heard your podcast with Dr. Tom. That was great. So there's definitely a place for those kinds of things. But my angle is coming at it from the microscopic aspect, looking at how that impacts their biochemical pathways. Example of that could be something like if a patient has a genetic polymorphism for the COMT pathway, catechol-O-methyltransferase. This is an enzyme that, if they have a genomic SNP or a mutation, then they're making an enzyme that doesn't have the right shape. It doesn't work as well. And therefore, it's harder for them to detoxify catecholamines, detoxify estrogens, detoxify environmental toxins. So if by looking at their genetics, I can see if they have a SNP for it. And if they have a SNP for it, then there's some things that we can do to help mitigate that. So they might have a higher need for B vitamins. It might be a little more important for them to be mindful of their stress, that kind of thing. So looking at their structures through their genetics, essentially.
No, that's awesome. I really like that approach, and I think that's going to be one that our listeners are really excited to hear, because genetics is such an up and coming area of medicine. Now, obviously, one of the questions that's probably on everyone's mind is, okay, if when it comes to genetics, is what are your thoughts about 23andMe? Is it a good idea? Is it a bad idea? What's your opinion on that?
Yeah, I'm not a huge fan of 23andMe, primarily because of my concerns about privacy, and then the fact that 23andMe gives you the whole, all of the genetics. So you can get into some analysis paralysis with that, where you just kind of don't know what to focus on, what's important, what's not. So for that reason, I don't typically encourage my patients to do that, but I'm not against it. I just think that there are some nuances to it that make it a little hard to use in practice. So I try to focus on SNPs or mutations that are prevalent, meaning they're common, they're modifiable, so we can do something about them.
Right.
And the ones that basically are oriented towards health and performance. So that my genetic view is a little more focused than what we might see in a 23andMe.
Yeah, awesome. No, I appreciate that approach. I mean, and at the end of the day, I agree with what you say. A lot of people can get analysis paralysis, or they don't have the ability or the resources to go in and really understand what their report is telling them. And at the end of the day, there's some stuff that's going to come up that you can't do anything about, but the ones that you can do something about, let's take action on that, right? And so, let's just make it applicable. Let's do something about it. And so I really respect how you go and approach that, as opposed to some other docs that I know that will go and, really do an in-depth report of the whole thing. But at the end of the day, you leave with nothing that's applicable. So I think that's super important to be able to do. If not, one of the questions that I got drilled into me in medical school a few different times was like, okay, we can run this test, but what's the action that's going to be done if it comes back with X result?
Right.
And if at the end of the day the action was nothing, it's like, well, then why run the test? There's really no point. And so, I respect your approach for that.
Exactly. And tests aren't going to fix people. It's really we run tests to answer clinical questions and to direct treatment. So you're absolutely right.
Yeah, no, that's awesome. Well, cool. Dr. Warren, I think we gave a really great overview for what this series is going to entail. And so is there anything else you'd like to add before we sign off and then meet our listeners on the next episode where we talk about gut function?
Yeah, I just want to thank you again for having me on the podcast. And it's great. It's always great to catch up with you. And I'll look forward to the next episode.
Awesome. Perfect. Everyone, thanks for listening, and make it a great day.
Thanks, everyone.